So this is a video that I'm making for central incisor carving. So before doing carving any tooth, carving of any tooth, like you first need to understand or look at the picture and you have to develop a memory of the shape of the tooth in each of the 5 different views that you can have. So you have incisor view or the occlusal view, this one. So in the occlusal view, the tooth looks more like a triangle, and in the labial view and lingual view, you have crown, which has a lot of differentiations from the mesial to distal side. If you see the distal corner, it's more rounded. Then the mesial corner, this is more pointed, and the palatal side or the lingual side would be a mirror image of that one. So normally, like when you draw midline from here, this point is not going to be symmetrical on both sides of the midline. So the tooth is going to be unequally distributed from one side to another side. So you draw a midline, it's going to be distributed this side and this side. So when you are carving, when you start carving from a side which is not symmetrical, you might end up having a lot of problems when you're finishing the tooth. So for this reason, like in most of the videos and tutorials that I'm going to make, I'm going to try and start from a view which is more symmetrical. Not one view, like normally, like when you carve labial, you are also like going to carve the palatal side. So you're starting from labial side and you're going to go through and reach the palatal side. So normally it is either labiolingual view or mesiodistal view. So mesiodistal view here and here, if you see, like they are like also mirror images, and when you draw a line from the root tip to the crown tip like this, the tooth is actually like more equally distributed in both views. So for this reason, like it will be much more easier for us to start in this view, mesial or distal view, mesial or distal outline, and then proceed to the labiolingual outline. Okay, that is the thing. So this is about the basics of the outline of the tooth. One more thing about the root. You see the root tip would be like when you try to bisect the tooth perfectly, like the root tip is going to be slight bit on the distal side of the midline that you might make. For example, like I'm talking about something like this. So when you do this, the root tip is going to be slightly outside the midline. So this means that the root is tipped or curved a little bit towards the distal surface or distal side of the jaw. Okay, so that's the difference. And another difference is with the line angles, where the distal and then incisal line angle is more rounded. The mesio-incisal line angle is more pointed. So this is another difference for the crown in the labiolingual view. So all these things you have to remember, and then you also have to remember about this cement enamel junction line, which is more concave here, and then in the labial and palatal it is more convex. In the mesial and distal it is more like a concave line. It's not like on 360-degree demarcation between root and tooth. And coming to the measurements for the tooth, the most important measurements: height of the crown. So height of the crown is 10.5 millimeters, cervico-incisal, meaning like cervical line to incisal area. That is like from this point to this point, which is 10.5. And then the root height, root length, 13 millimeters. Again, it is from the cervical line to the tip of the root. It's 13 millimeters. 10.5 and 13. These are the most important dimensions that you have to remember. And 2 other dimensions also you need to remember. This one, 8.5. So 8.5 is mesiodistal diameter. Mesiodistal diameter is like, this is the tooth. Okay, let me explain the picture itself. Like, so mesio distal, so from mesial side to distal side, this length is 8.5. And then you have another measurement, 7 millimeters. This one, this is labiolingual diameter. So the labiolingual diameter is 7 millimeters. So labiolingual diameter is usually seen in mesial or distal view. So it is referring to this distance from this point to this point. So from this point to this point, it is about 7 millimeters. See, these are the 4 dimensions which are more important for the central incisor. So the first step that we will do is like demarcation of this crown space and root space. So take a block. If it is rough, just scratch on the surface, remove all the roughness and other irregularities, and then you start demarcating the height for the crown and also for the root. So the crown height is 10.5, but for carving, normally like I have multiple times explained in the class that when you are carving, you need to take a small bit extra so that in the final you have some wax left behind for polishing, finishing and doing small corrections. So instead of taking 10.5, so this is 10.5, but I would like to take 11 or 11.5 so that we will have some wax left behind for some finishing in the later stages. So 11.5, I made a small dot on 11.5. So we are going to make a line in that place. So this line demarcates the crown space, and then from here you need to take 13 millimeters for the root. So since we are taking more than 10.5 for the crown, for the root we will again not take 13 exactly, we would take somewhere around 14 millimeters. So 14 millimeters. That's 14 millimeters, and then you draw a line from here to here. So now we have 2 lines demarcating the crown height and then root height. Crown height is 10.5, but we will take 1 millimeter extra, 11.5. Root height is 13 millimeters. Again, we will take 1 millimeter extra for finishing. So it will be 14 millimeters. So normally the height is 10.5 to 13, but we have taken 11.5 to 14 for keeping some wax for finishing. So we would also like to transfer this line to the other sides here, and then again on the other side goes back and gets connected to the crown line on all the sides. So this crown line is getting transferred to all sides of the block. The same way the root line also has to be transferred to all sides of the blocks. Approximately. Okay. Now since it's finished now, so now I'm going to make or draw the mesial outline of the tooth. Like I told you, like I'm going to start off from mesial to distal outline, and this would be more easier because it is symmetrical from one side to another side. So first thing that I will do is I will draw a midline. I'm going to draw a midline, a line that is bisecting this space that is available for me. Okay, that's the midline. And then as we discussed, like I'm going to draw this view. So the thickness, maximum thickness of from one side to another side, from this point to this point is 7 millimeters. So when I bisect 7 millimeters, it will be 3.5 on this side and 3.5 on this side. So 3.5 is something difficult to measure from the ruler and on the wax block. So we would take 4 millimeter and 4 millimeter. So effectively it becomes 8 millimeter. This is also like in accordance to the previous technique. Like so all the measurements are taken half a millimeter to 1 millimeter extra. So what we will do is like from this point you take 4 millimeters and then you draw a line, 4 millimeter line on both sides. I'm making an approximate line. I'm going to check now how much it is. I'm going to check from this side to this side. So that's approximately 8 millimeters. Perfect. So we are right on track. We have divided the space into 4 millimeters and 4 millimeters. Now there is another division that I want to make. The thirds, occlusal third, middle third and parietal third. So I'm going to divide this crown space again into 6 boxes. Now we have 6 boxes representing the labial half, lingual half, occlusal third, middle third and cervical third. So the first thing that I want to draw is cingulum. So the first thing that I want to draw is cingulum. Cingulum is usually located in the cervical third. So I'm going to draw the cingulum. Make a dot here, halfway between this point and this point, and then you connect that dot like a curve, a small curve representing the cingulum. On this side, labial side, the lower half is more straight, and then the upper half from this point, it goes down like this, like a curve. So now we have finished drawing the convexities. So the labial side is like a single convex surface, and then the lingual side is like convex, and then it becomes concave. So the concave portion again is like, make a small extension, and then it comes in like this. So that's the shape. I hope you can clearly see it. And then I'm going to also draw the root shape. Root shape is like upper half is more straight, upper half comes more straight down from the point, and then after halfway it becomes a little bit more pointed like a cone, and it connects like this. So that's the shape of the tooth from the mesial view. So just as a refresher, like what we did was, like, we first demarcated the crown space 10.5 millimeters, 13 millimeters, a little bit extra, so we took 11.5 and 14, and then we made a midline. From the midline we took 4 millimeters from here, 4 millimeters from here, and then we divided this into 6 cubes, 6 squares. And then the first thing we did was drawing the cingulum. So cingulum is located in the lower third, so we restricted that diagram to the first box, and then we finished the labial side. First off is straight, and then it curves in and comes to the midpoint, and then from the midpoint you make a small extension towards the parietal surface, and then from this point it's like a curved surface. So the outline is completed. So now we have to remove all the wax that is lying outside this outline, all this wax, this and all of this. That is what we are going to do. So first I will concentrate on removing this side. So this side, if you notice, like the concave outline is actually like matching with the carver. So I can actually use this curved surface of the carver to create this concavity. So concavity, we will start as flat surface initially. Like for example, like I'm going to create a flat surface which goes from here to here. This one, I'm going to remove all the wax here, and then after I come close to this line, I start using the back side of the carver. So this matches with the concave surface, and it automatically gives me a curved surface for the lingual area. So the first thing, I'm going to reduce the corner. How you will reduce the corner normally is like you hold the block like this, and then use the back side of the carver, then you start scraping it. So we make a flat line, you can notice, change it here. So this is what you are trying to do. So we are going to keep scraping on it and keep extending the flat line like this. One thing you have to do is, like, you have to transfer this midline also to the top of the block. From this point we transfer this midline to the top of the block like that, because when you're creating this flat line, the flat line stops at this point. So you're carving, when you're carving on this side, you should not cross this line. Your carving stops here. Your instrument should not go beyond that line. I'm using a white wax. White wax is usually brittle. So when you have a brittle wax that is not really very soft, you need to go really very slow, remove it layer by layer. I'm getting closer. I'm trying to create a flat surface, perfect flat surface. I'm extending it. The flat surface is becoming more flatter and flatter. Sometimes to speed up things, you can also use the ruler. Ruler can evenly contact all the surfaces and it can create a perfect flat surface without any irregularities. Sometimes with carver you might have a lot of irregularities. So when you want to create a flat surface which is more even, you could also use a ruler. Just trying to stop and show you where I'm reaching. Please notice that like now I'm approaching this line very closely. So from this aspect I have reached the point where I should stop carving. So from this aspect, from the cervical aspect, I still have a lot of wax to be removed. So I can still keep scraping. So now my carver doesn't go contact this point, it stops somewhere below and then it gets angulated like this. Transfer the crown line, make it more prominent so that you know where exactly you are going. I'm almost closing in on the borders. I still have this portion of the wax left. So now I will start using the concave surface. So I go back and forth and then I will start creating a concave surface. Can see it's not flat anymore, it is beginning to look like a concavity. Okay, that's what I'm talking about. It's actually matching the shape of the carver. Now we are really very close to the outline. Now we have to reduce the wax from the cingulum area. So when you start reducing this point, you have to hold the block like this, use the back end of the carver and then place it at an angle like this and then start creating a groove, a small groove. So this would be like a starting point from where you can start moving your instrument and you start creating the convexity. So that's a convexity. So first you need to create a depression for the cervical line. This depression should not be very deep or very prominent. It should stop exactly at the outline. It should not go into the outline. Please remember. You start making it blend. Okay, a bit more. So we are really very close to the outline. Just have a small bit of wax left behind. So I'm going to keep going back and forth. I will make it more concave. Please make sure that all the while when I'm doing this, that I stopped carving at this point at the midline. Okay, I am not going to the other half of the block. I am concentrating really properly to make sure that I'm not crossing the other half of the block. I'm carving only on this side of the block, the lingual side of the block. Keep changing the direction once in a while to make it more smoother, so that you will not have too much lines. So you can see like I have a convexity and then a concavity. Take a brush, clean off all the wax flakes. Now check the outline. Almost close, just a small bit wax left behind. The idea is to keep the outline as perfectly as possible, because we are already making something larger. So if you're again leaving some wax outside the outline that you're making, your carving might become a bit more bigger. So for that reason, like, since we are not taking exact measurement, we need to perfectly cut all the wax outside the outline. You should not leave any wax that is present outside the outline that you are making. Okay, that's the outline. Okay, the lingual outline is completed. It's more perfectly or closely matching the outline that we drawn. Now we are going to remove wax from the labial outline, this place. So same thing, transfer the crown line, make it more prominent, then start reducing from this point. Make a flat surface. Keep making the flat surface more wider. Use the back side of the carver. For the labial side, do not use the curved side of the carver. If you use the curved side, you are going to create something like a concavity, and then it won't look natural. So use the flat side of the carver. I'm changing the direction, once coming like this, and then a little bit like this. This would keep continuing until I reach the outline that we have made. more wax left behind. You see the occlusal surface, it's more flatter. It should not be flatter, it should be just about 1 millimeter to half a millimeter in width. It should not be so wide like this. Now this is almost like, how much? It's about 3 to 4 millimeters. That's too wide. Your incisal edge is not a surface, it's more like a small ridge. So it's just like half a millimeter to 1 millimeter. More on the smaller side, not on the 1 millimeter side. Almost done. Still a little bit more wax left behind. Please notice I'm using only the back side. I'm not using the convex side. If you use the convex side, you will lose a lot of wax and there won't be any convex surface. You will have concavity. So when your instrument is convex, the surface that it creates will be concavity. If your instrument is concave, the surface that it is creating would be convexity. You can also create flat surfaces and curved surfaces using a flat surface also by just moving around like this in a circular motion. So some of the carvers are not flat, they are actually like little bit like more concave, like the mango carver. So if you are using that, you could actually use the concave surface and you go about back and forth like this, and then it can create a convex surface. The outline is almost complete on both sides. I would like to remove a little bit more. I would like to measure it once before I remove. Now it is about about 8.5. I would like to reduce it a little bit more because this dimension is just about 7 millimeters. So I'm trying to reduce a little bit more so that it is somewhere near 7.5. A small bit wax I'm leaving behind for adjustments in the later stage. Now I think the margin is perfectly closed in. Just the palatal side, it seems to be having a little bit more wax, but I prefer to reduce from the labial side because labial side is more flatter. From the palatal side, if you reduce, like sometimes you lose the prominence of the cingulum and that will make the tooth look unnatural. You need to have the cingulum a bit prominent for the central incisor. For the lateral incisor, the cingulum is a little bit less prominent, but for the central incisor, the cingulum is a bit more prominent. Like that, and I'm going to continue down, and then I'm going to remove all this wax that is present outside the outline of the root also. So we're going to now start removing the excess wax on the root portion. For the root portion, when you're removing the excess wax, do not go in and then make it narrow in this place, because if you make it narrow in this place, the base would separate from the carving. So until the final stages of the carving, it is better to retain the base, because it is on the base where you are going to mark which side you are carving. So this side is going to be mesial side for me, so I'm making a small mark on the block, base of the block, as M, representing the mesial side. So now we will remove this portion of wax, and we will leave this small portion initially for the final stages to make it narrow. So we are going to just make a cut from here, and it passes through, and then it removes all the wax on this side. So when you want to start, you start making a groove in this place. It's like a small point where your instrument can rest and start creating this point. That's the point that I'm talking about. You can also use a ruler. Maybe it's more easier, more smoother and cleaner. But this ruler of mine is a little bit blunt, it's not very sharp. So if you have a sharp ruler, you can use that. I'm going to stick with the back side of the carver, the flat surface, back side of the carver. So I'm going to start carving like this. Keep changing the direction once in a while. A few strokes like this, and then a few strokes like this. So changing the strokes is to make the surface more smoother and cleaner. So we are trying to reduce this portion of the wax. We are trying to contact the instrument perfectly from one side to another side, one side to another side, so that when you are removing this, some amount of wax on this side, the same amount of wax is removed from the other side also, and this outline follows the outline that you have made on this side. See how I'm trying to remove. Yes, that's almost done. I want to make sure that it is a little bit thinner, because the root is more thinner than the crown. So if the crown is 7.5, the root would be somewhere around 6.5 in this dimension. So it is better to make it a bit more smaller than the crown, so that it appears more natural. So if a crown is smaller in diameter and then the root is projecting out of the crown, it might not appear natural. Do not create a depression. For example, like, see, if you notice, like from the cingulum there is a small depression inside and then it goes straight. Do not try to create a constriction in the cingulum right now, because if you create it right now, like in the final, you will have too much constriction. So to avoid that, we are just trying to create a flat surface, something that comes straight down from the cingulum like that. So this side is done now. I'm going to now start reducing wax from this side. So it's basically like, again, we are going to come straight down like this. I'm going to remove just this portion of the wax. The same thing, transfer the outline and then start making a groove here. Please notice, like when I'm making this groove, the carver is contacting only on the tip. Should not keep it like this. If you keep it at an angle, the cutting efficiency is more. If you keep it more parallel, cutting efficiency of the end of the carver becomes a bit lesser. So that's what we're trying to do. We removed the wax. There is still a little bit more projection here. I want to remove this portion also. So here there is still some bulge from these portions. The corners are reduced, but the center is not perfectly reduced. So we could go about few more strokes to reduce the thickness. And it's like this. And now the outline, you can notice the outline. The cingulum area is the most widest, and the root is a bit more inside the cingulum area, the diameter in the cingulum area. I want to reduce a bit more on the root surface just to make sure that it is not going outside or it is not more wider than the cingulum area of the crown. Okay, that's the outline, that's the point. Now I think it's a bit more on the right size. Perfectly remove all the wax outside the boundaries. Like that. And that. So the outline is now perfectly transferred from one side to another side. You can see the tooth looks symmetrical from both sides. Now we are going to mark the labial outline. Something that you have to refresh about the labial outline. Labial outline is like, if you imagine this corner to be also sharp, it's going to be like a trapezoid, like this. So basically what we will try to do is like we will try to carve a crown which is trapezoidal in shape with both the corners sharper, and then we will try to just differentiate the root initially, and after the root is differentiated to the distal side, or like it is carved to the distal side, and after we finish we will take a polishing cloth and then we will just round off the distal corner so it appears different from the mesial corner. The mesial corner is sharper and distal corner is more rounded. So that is how we are going to differentiate it. The dimension is like 8.5. From this point to this point it's 8.5. So 8.5, you have to draw a midline and then divide it into this side and this side, which is approximately 4.25 and 4.25. Again, it is difficult to measure 0.25 on a ruler, so we are going to take it as 9 millimeters instead of 8.5, and we will try to separate 4.5 and 4.5 on each side, or maybe 5 and 5 on each side. That would be 10 millimeters, 1.5 millimeters more than what is required, but we can always reduce it and make it come closer to 8.5. So 8.5 can also be sometimes be 9. It's not really a big problem because you can reduce it later. So the first thing, again, when you do the carving, you have to first mark the demarcate the spaces. So first thing that you will do, you will mark a midline. So keep a carver, go down and then mark a midline, demarcate the space, make it a bit prominent, make sure that it is approximately centered, and then from this point you are going to take 4.5 millimeters from here approximately, and then make a straight line down like that, and then also on the other side. So we are basically actually like going to transfer this line also to the root portion, and then on the other side also. So what you can do is like, if this is my mesial side, this is my distal side, my root is going to go towards the distal side. So this side actually, like when I draw the line, I can actually make it a little bit more slanting and closer to the midline. B like that, slanting a little bit out like that, and then this one again coming down straight like this. So basically, like every other side, you're going to remove the wax outside this outline that you have made. So since you're trying to remove all of the wax together at the same time from the crown and also to the root, we'll start carving it from the tip of the root like this. Keep stripping it little by little, layer by layer. Please remember, if your wax is brittle, be slow. Do not force your instrument into the wax. It can create cracks inside the wax, and the wax itself can break actually. So you can see we are trying to close in on the outline. I made a small nick when I'm trying to do. That's why I'm asking you to make it as 11.5 or 10. So when you're hurrying up, sometimes you have small nicks like this in the corners. So when you take exact measurement, the tooth might look really very small. So for that reason, it is better to take all measurements a little bit longer than what is recommended in the textbook. Now the outline is complete for this side. Now I will start removing wax from this side. Just this side is remaining. You can also use a ruler. It's like a flat reduction. You can see a ruler is more helpful because it removes wax more evenly. Just keep looking at the outline. Make sure that your ruler is not haphazardly removing wax from different directions. That's the outline. We are closing on it. When you come closer, you start using your wax knife, carver, lacron carver. You can actually notice, like, I'm also like slightly trying to narrow down the portion of the root, which eventually we will have to do in the end. Like this. So when you look from above, right now the block will appear like it is rectangular, but as we discussed, like the outline of the tooth from above is more like a triangle, rounded triangle, and the apex is towards the palatal side, so we would be now trying to convert this squarish shape into a triangular shape, a triangular outline. So when you want to convert a square or a rectangle into a triangle, you need to cut from two corners, from here and here, and automatically it will look like it's a triangle. You can see if I cut from this corner and from this corner, the tooth will start looking like a triangle. So before cutting, we first again have to mark midlines on all the sides. Mark a midline for this view, mark a midline, the same thing on the other side, mark a midline like that. Here up the midline here. From the palatal side also mark a midline. So now we have midlines from all sides. When you look from above, you must be able to see a plus-like demarcation of the midlines meeting in all places. So now what we have to do is, like, now we need to make something like a triangle. So from the incisal edge 2-3 millimeters below, starting from here, you go down and draw a line like this. Then also from the other side, this side and this side. So now we are going to remove this portion of the wax, from the corner, like this. So this triangular portion of the wax has to be removed. Like I told you, like if your instrument is sharper, if your wax is softer, it is very easy actually to cut just with one stroke. But normally the white wax and most of the wax that we are using is more brittle, and our instrument is not really that very sharp, so we will start reducing from the corners. You can see I'm creating a small flat surface. From this point to this midline. So the reduction is limited to this two midlines. That's why we have to draw the midlines. Just keep rotating the carver like this. Now you can see, like, I reduced from this side. One side is reduced. We still have this side, this corner to be reduced. Use a brush, clean off all the flakes. Then now it becomes more evident. I hope you can see the triangle now, one side of the triangle that is forming. I'm going to do the same thing on this side, on the corner. Keep removing until we reach the midlines. Now you can see the triangle is forming perfectly. Please notice I am using the back side of the carver, the tip of the carver on the back side to remove this waxes. I am not using the curved surface because we are not anymore trying to create a concavity, we are just trying to create rounded surfaces. So for rounded surfaces, you should not use convex side. You should not use this side. You should use the other side and the tip of the instrument. Keep the tip, and then you can just go around, creating the constriction or the taper in the cervical area. Please notice the prominence of the cingulum, then the triangular shape. Again, like this corners, this corner and this corner has to be also rounded, because the tooth is not having a sharp corners of this one and this one. It's a little bit sharp here, so I'm also going to round that off. Keep the carver in the corner and just go around like this a little bit, and it becomes rounded. I hope now you can appreciate the rounded edges and the triangular outline of the tooth. We need a tapering towards the cervical area, so I'm creating the taper by keeping the instrument tip contacting the cervical line. Do not try to create a deep constriction. The taper should be like really very gradual. The crown is shaping up really perfectly well. The crown is almost done. So now what I will do is, like, I'm going to remove all the excess wax that is present on the root portion, all this excess wax that is around. Then keep the carver like this and then just start going down. So I'm trying to create something symmetrical now. I'm not trying to create the distal tilt. I'm just going straight from the surface of the crown. I'm trying to create something more symmetrical. So until this point I have not differentiated this tooth into right side or left side, but we want to carve the right side incisor, right side of the patient, first quadrant 1 1. So the tilt has to be on the distal side. You remember, this is the mesial view, so we have drawn this. So distal is on this side, mesial is on this side, so the root has to go to the distal side. So I have to remove more wax from here, and automatically the tooth will appear like having a root that is going towards the distal side. So I need to remove more from the mesial side. That this is a thing, like I'm trying to remove more wax from here, the lower half of the mesial side, lower half of the mesial side, to make it look like the root is going towards the distal side. Coming down and then scooping out, it's like that. Can now see I removed more wax from here, less wax from this side, so automatically the tooth would appear like having a root that is going towards the distal side. So that's the trick. Carving is almost done. We have a small projection here, you see it's bulging out, so I'm going to reduce a little bit wax from here. Right now, like actually there should be a small constriction here and here, but I'm not creating that now because my tooth might separate out from the base. So now I'm going to concentrate on creating the cingulum area, the palatal surface now. The tooth is now geometrically complete. We still just have the small details, fine details to be carved on the palatal surface. Otherwise the tooth is like almost complete. In this view you can see like this corner needs to be more sharper, but this seems to be a bit more sharper, so we will round that off. I want to remove this small dent that I'm having. So this is the distal side, this is the mesial side, so I have to round off this corner a little bit. How can you round off? You can just round off with your fingers, just keep rubbing on it, become slightly more rounded. I can see like this is more sharper and this is more rounded. I have a rounded distal corner and then a pointed mesial corner, and then if you try to make a midline, the root portion lies more on the distal side, indicating that this tooth is 1-1 belonging to the first quadrant. Now I will start making the palatal side. Palatal side, the fossa is like more like a W shape. So you have a line, make a small groove. Make a small groove on both sides, 1 millimeter inside the outline. Can also use back side of the cover for this purpose, because we are trying to scoop out some wax here, this side and this side. So we scooped out some wax from both sides, and now like we will demarcate the cingulum. Like a circle space and then up like this. So this looks like a W coming down, going up, and then it's like that. Then you have, now you created some depression on this side and on this side. Now you will have a small bit of wax left behind between the depressions, which also you have to remove. I'm going to take some pictures of the cingulum. Because it's white wax, the light is reflecting too much on the wax. You are not able to see this really very perfectly. So after I finish, I'm also going to take some pictures of the finished one, so you can appreciate what shape we are trying to create on the cingulum. Basically, it's like we are trying to create a concavity, leaving a small bit of wax in both sides so that it looks like a ridge. I hope now you can appreciate. It's like a W. Down, up, down like this, and then flaring out like a fan. So that's the shape of the tooth. On the mesial side, you can still reduce a little bit, make the root a little bit narrow. When you are brushing now, the wax is thinner. Be careful, do not brush with too much force. Even if the base is breaking, do not get stressed too much. It is okay to make it without a base. The base is actually to know which side you are carving. So this is my mesial side, so the opposite would be distal side, D, distal side, and then this is obviously the labial side, L. Lingual also will be L, so I am going to use palatal as an indication here to differentiate between labial and lingual side. This is palatal side, and that's the view from the distal side. The cingulum is a bit prominent. I'm reducing it a little bit to make it more subtle. And after this, you have something that has to be done for the root portion. You have something called as developmental grooves. Mesial developmental groove, a small depression on the roots. You can use the back side of the cover for this purpose, or you can also use this one. Like that. You have to create the same thing on the other side also. mesial and distal developmental grooves. Not so deep, just a small bit of concavity. Like that, and that, and that, and then you have to now draw the cement enamel junction. Cement enamel junction goes up and comes down like that. Skin is carver, go around, just mark a line. Mark a line like that. Okay, now it's the same thing on the other side. Go around, take it up, then take it down back to the cervical line. Like that, and we are done with the carving.